Every year, 2 to 10% of pregnancies in the United States are affected by gestational diabetes, a type of diabetes that can develop during pregnancy in women who do not already have diabetes. Dr. Greg Silverman joins us live today to discuss. Good morning, Dr. Silverman. Thank you so much for being with us today.
Good morning. How are you?
I'm doing great. Good to see you. So why does a woman develop diabetes during pregnancy? What causes gestational diabetes?
Well, it's really more insulin resistance. That is, your body produces insulin but can't use enough of it. And so your sugar levels go up. It's generally in the last trimester of pregnancy as well.
What type of complications can happen in babies when their mothers have gestational diabetes?
Well, if your sugars are out of control, you can have increased birth weight, which means that you can't deliver normally. You'd have to have a cesarean section. You can have certain types of birth defects. It can increase your risk of having diabetes later on, even the child's. And when you are delivered, it can have problems associated with hypoglycemia. That is, once the child gets out of that and has that amount of insulin, you can have hypoglycemia afterwards, after the birth from the child as well.
How do moms-to-be, how can they know if they're experiencing the normal woes of pregnancy or if they're actually suffering from diabetes?
Well, the only way that you have to do that, there are certain symptoms. That is, if you are horribly thirsty or more thirsty than you ought to be, or if you're more hungry than you ought to be. Now, that's hard to determine when you're pregnant. No, every woman is hungry while they're pregnant. If you urinate too much, it's more a test of talking to your physician about this and getting tested before anything really is the best diagnosis.
If this happens to the mom, is it more probable that the baby will have diabetes and the mom will have diabetes after the baby is born?
The answer is yes. I mean, the risk of having diabetes afterwards is higher in children. Now, that often goes a little bit longer. It's not right away. It happens as they age a little bit. And the risk of diabetes, future diabetes in the mothers is higher as well. And so it's very important that you understand that there's a possibility of gestational diabetes, and the treatments for gestational diabetes are really medical, dietary modifications, exercise, and talking to your physician about really, how do I do this? How do I lose weight, or how do I maintain a healthy weight during my pregnancy and then after my pregnancy as well?
That's very important. I'm glad that you said a lot of people that I know when I was pregnant, I was thinking, oh, I can eat whatever I can do. No, you still have to be healthy for you and your baby. Thank you so much for being with us, Dr. Silverman. We're looking forward to having you again next week. If you have a question for Dr. Silverman, please text the question to the number on your screen, 361-855-6397.